Hi, everybody. I'm Dr. Kirsten Sumner. I'm one of the orthopedic hand and wrist surgeons for the Core Institute in the East Valley. Thank you for joining me tonight to talk a little bit about arthritis of the hand and wrist. I'm going to kind of go through this topic as much as we can in detail, but a lot of this stuff can get down to the nitty-gritty into what joint you're having a problem with, but we can go over kind of the basics of what the hand and wrist arthritis is, and some non-surgical treatment options, which is really good for any type of arthritis throughout the body that can be helpful. And then some specific brief overview of some surgical treatment options of various areas that you can get arthritis in the hand or wrist. So we're gonna start here by going on to what is arthritis. So get this a lot of times, people think, is this arthritis? I think I might have arthritis. I have pain, like what is going on in my hand? Well, the definition of arthritis is inflammation of the joint, basically. And that can be from various types of etiologies. Can be related to infection that has damaged the joint, can be related to wear and tear type of arthritis, rheumatologic conditions where you have inflammatory diseases that cause it, post-traumatic. So there's a lot of different things that can cause inflammation of the joint. But once you get inflammation of the joint, that is arthritis, okay? So we're gonna continue on. So one of the most common conditions of the hand is arthritis, and I see that every day. I think I gave a brief lecture like this about 10 times today, and the same thing yesterday. Shows up in my clinic all day long, because unfortunately, arthritis happens to everybody at some point in their life. Symptoms related to wearing of the joint surface can lead to that pain, swelling, stiffness, and then weakness, because when you have pain, you feel weak because you can't do things with your hands because it hurts too much. Like I stated before, different types of ways that you can get arthritis. Wear and tear is that every day, you use your hands and over time, they wear down at the joints. Post-traumatic, you get a break in a bone that goes into the joint surface. It causes that joint surface to be affected and cause inflammation of that joint. Infection, really breaks down that joint. And then, like I stated, that inflammatory arthropathies, which everyone kind of knows of as rheumatoid arthritis. We're gonna go on to the next place. Where can it happen? So this is just a brief diagram that we have about the hand and wrist, and you can get arthritis in any joint. So in order to get arthritis, you just have to have a joint, okay? And those are all over your body, but the hand has many of them. The joints at the end of the finger, kind of out in this area, that doesn't show a cursor. But joints at the end of the fingers are the distal interphalangeal joints. Those are the most common. Those are the ones kind of at the tips here. The second most common is actually the base of the thumb. And then we kind of go into these knuckles here. And then most of the time, these joints are actually spared. Wrist arthritis obviously can also occur throughout the wrist. And that's kind of a joint that involves where your forearm, so your radius and your ulna, which are your forearm bones, come into all these little bones at your wrist area, for which there are many, okay? So what does an arthritic hand look like? Well, a lot of times you'll kind of see this kind of knobbly looking hand, and they're called nodules that can develop at the joints. So at these joints out the end, they're called Heberden's nodes, and at the joints here, they're called Bouchard's nodes. And what they are is basically, as the inflammation sets in the joint, it breaks down the cartilage and the bone starts to grind on itself. And it can develop kind of more bone. And you can get this appearance where you get these looks like knots or bumps on the back of your fingers, and that can be a sign of arthritis. Over time, you can also develop some cysts, commonly at the end joint as well, where you get a small cyst that can be very painful, and that comes from the joint. In addition, as the arthritis progresses, you'll kind of see deformity of the fingers. Your fingers start to look a little bit crooked because that inflammation, in addition to breaking down that joint, also can affect your ligaments and the supporting structures around the joint, and your finger joints can start to look kind of crooked, all right? Signs and symptoms, pain, right? So inflammation causes pain. I always tell my patients, to get your pain improved, you want to try to decrease your inflammation. And since this is an inflammatory problem, obviously pain is involved. Swelling, especially as a joint is really flared up for you, really inflamed, you're got swelling. Stiffness, as that joint, that cartilage breaks down over time, the joint can't move as fluidly. So you can get stiffness in that joint, not getting that full range of motion that you're used to having. Like you said, finger deformity, and then weakness. And weakness is more of a byproduct of the pain that you're getting, preventing you from doing things because it hurts too much. Because basically, as the inflammation sets in the joint, the cartilage wears down. It's kind of the buffer between the bones. And it's like the lubricant almost, if you want to kind of consider it that. And then over time, as that buffer gets closer and closer together, as that inflammation breaks it down, those bones are grinding on each other, giving you all these symptoms, and then that weakness that kind of comes with it. This is just showing some x-rays of what arthritis can look like at your joints. The main thing we're looking at on x-ray is looking at loss of a joint space. I kind of circled some areas on those x-rays that show you where the joint has really gone away. At some of the other areas on those x-rays, I can't really point to them, but you can see that there's a bone, a space, and then another bone. That's what you want. You want to see that space because that shows me that there's cartilage there, because you can't see cartilage on x-ray, but you want that space showing that there's healthy cartilage there. As that space starts to go away, as you can see on that one x-ray, kind of at that middle finger knuckle there, and then at the end knuckle there, you don't see any space between those bones. And that's a sign that if there's no space, well, there's no cartilage. And if there's no cartilage, your bones probably hurt when they're grinding on each other when you're moving your fingers. The thumb joint is really important. I see this really commonly. Like I said, the end joints are the most common, but our thumbs are responsible for so much of what we do on a day-to-day. So I am constantly seeing new patients and treating patients established for base of thumb arthritis. Like stated on the slide, osteoarthritis of the base of thumb joint in up to about 30% of patients and up to 91% of patients over 80 years old. So arthritis at the thumb happens over time because of all the wear and tear. Our thumb has so many motions and so many uses. We put a lot of stress through the joint when we do grip and we do pinch, and everything that we grasp with every single time, you're putting all that stress to the base of the thumb. So it does commonly get arthritic. And on that slide, you can see once again, the joint that I'm talking about and that kind of loss of that joint space. So is there a cure? Well, bad news, no. Unfortunately, there's no way to prevent arthritis really from occurring. There's no preventative medication. You take it, you'll never get arthritis, and there's no cure. But if you come up with a way to cure arthritis or prevent it, please include me. We will become billionaires together. Why? Because everyone gets arthritis, and it's the big thing that I just wish we had a way to prevent it from getting worse or cure it once it starts happening. The way that we do treat it is based on the symptoms and the inflammation. Now, a subset of that, when you talk about the inflammatory arthropathies, things like rheumatoid arthritis or lupus or psoriatic arthritis, there are medications that can be taken to decrease your disease progression with those type of conditions. And for that, you see a rheumatologist. So if someone does come to my clinic and I think they have rheumatoid arthritis, I usually get some labs, evaluate them. If they come back really elevated, really abnormal in their bloodstream for markers that indicate they might have an inflammatory condition like a rheumatoid arthritis, then I send them to a rheumatologist, because you can get on medications that can actually slow the disease from getting worse so that your hands don't get affected as badly and as quickly. It's still not a cure, but it's prevention of disease progression, which is different from that basic wear and tear arthritis. So what can we do? I just told you we can't cure it. We can't prevent it from happening. So you're like, well, what can you do? Well, we focus on decreasing inflammation. The big thing here is inflammation. The inflammation is what's causing you pain. And there's various ways. I group arthritis treatment into medication management and then mechanical management. Medication being various oral, topical, injectable medications, and the mechanical being bracing, activity modifications, hot, colds, kind of this external stuff that we can do to try to protect the joint and help to calm it down and not continue that further progression of pain, that flare up that you're going through. Because I see patients with arthritis all the time. I sometimes see patients with something, they come in, I don't know what they're gonna have. I get an x-ray, they have horrible arthritis, but they're here for something completely different. And their arthritis, guess what? Doesn't hurt at all. You look at the x-ray and say, that has got to hurt, but it doesn't. Because arthritis can go through these kind of waves of being like flared up and angry and bad and painful. And then if you can just calm down that inflammatory event, get it more comfortable, you can actually live very comfortably with it for some time. When we start to talk about people needing surgery, it's when we can't get that flare up to end. No matter what we do, it just stays at this level of discomfort. that prevents you from doing your day-to-day things that you want to do. And then we talk about kind of other things like surgeries and such, which I'll get to later, to try to treat it. But definitely always approach arthritis with a non-surgical treatment first, because we might get many, many years of relief out of just doing these basic things, okay? So what type of medications? Well, man-made anti-inflammatories are things like ibuprofen, Motrin, Aleve. Those are great. I think they are amazing with anti-inflammatory, pain relieving, but they can cause stomach upset, ulcers. You have to take them with food. And so chronically taking these things is not the most ideal situation. So I always talk to my patients about natural anti-inflammatories. And a big one I showed in multiple different forms there is turmeric. Turmeric is something, it's a spice. You can cook with it, you can eat it, right? But it also has major anti-inflammatory effects, and it's natural. You can take this on a day-to-day basis. And it comes in various forms, whether it's capsules. I know that I think Costco now has forms that you can buy bulk bulk capsules, powder, liquid. There's various forms to get this natural anti-inflammatory. Other ones that are really good, ginger, arnica, capsaicin, fish oil, things that you can take to just try to take that edge off the inflammation. Because really what we're doing here is we're trying to do a little bit of this, a little bit of that, a little bit of this in combination to decrease your overall inflammation. And if you do these things, it really is successful. I see lots of patients with this, and we can calm down their inflammation by just doing various things that additively can make your symptoms get so much better. Topical medications. This I always is a trial and error group, okay? Patients say, well, I tried that diclofenac gel and it didn't work. And I'm like, well, did you try capsaicin? Did you try, Blue Emu? Did you try Bengay? Did you try Icy Hot? And they're like, no, well, I tried that one thing and it didn't work. None of these are the same, okay? And I have not found, I wish I did, one topical medication that works for everyone. I have some patients that come in, they start the diclofenac gel, which is an anti-inflammatory topical, also called Voltaren gel, and they'll try that and it'll be amazing. They'll be like, oh, it's great. I have other patients that come in and say, I tried that, it did absolutely nothing. So when it comes to this category, I cannot emphasize enough the importance of finding what works for you. Okay, I just said you have arthritis. You can't get rid of it really, right? So you need to figure out how you're gonna get your symptoms down if you're going through a flare-up. So it's worth the time to figure out what works for you. Buy a small container of something. If it doesn't work, okay, great. Buy something different. It does take a little bit of investment. But then if you find what you've got, great, buy a whole bunch of it, right? But you gotta figure out what's gonna work for you. I can almost guarantee that there is something out there that will work. You just have to find it out. Injectable medications. This is the last topical, and this is steroids. This is something we do to you, right? It's more invasive. It involves a needle poke, right? People don't like needles. Very small needle we use in the hand though, which is nice. Not a big giant joint we have to go really far with. Very small needle. So patients tolerate it pretty well. But steroids are strong anti-inflammatories. Kenalog on the screen is just an injectable steroid that we use. And basically you inject steroid into the joint and it calms down the inflammation. By doing that, it can get you your relief, right? Where all these things we're trying to calm down the inflammation. Steroids is like doing that to the max, right? We're localizing a very strong anti-inflammatory into the joint location. Steroids can give you various relief. It can give you weeks, it can give you months, it can give you years. I've done injections that have given people a year relief. I've done injections that gave them 3 months relief. It's no guarantee. I can't tell you how long it'll give you, but it is definitely worth it, especially if other things that are not as invasive don't work. Great, well, steroids are very helpful. Most providers will only do them every 3 months. My goal is not to have you need it every 3 months, but we typically don't do it any closer together than that. So if you get an injection, you really have to wait at least about 3 months before you could get another one. Ideally, I think we're winning if someone has bad arthritis and they only need like 2 to 3 injections a year. I feel like, okay, we're getting enough relief out of it and they're getting the life that they need to do without having to go even more invasive with surgery. Bracing. So this is the mechanical stuff. We talked about medical management, right? Now this is kind of more the mechanical thing. And these are various braces that I'm using on here to address different types of arthritis. The way that bracing helps is that a joint hurts more when it's moving. So if you have bad arthritis and you're going through a flare-up, Not that I'm not saying I want you to brace your hand or your wrist forever, right? The goal is, like I said, we want to take this flare up, we want to bring it down to as much of a manageable level as possible. And that's where bracing can come into play. You have a really bad inflammation of your wrist or your thumb or your wrist and your thumb, right? And you want to calm it down, great. Well, let's use a brace. Let's protect the motion. Let's try to help our topical medications, our oral medications, our injectable medications, give it all a boost to try to calm things down. Then we can start to get out of the brace a little bit more. These are different braces that I do use for treating arthritis. Now you're saying, well, there's no finger brace. Unfortunately, finger splinting or bracing can be very tricky because the longer that, you can't put a brace on your whole finger. That's kind of difficult to do things. But also, fingers get stiff very quickly. Now, I just said before, well, you get some stiffness with arthritis. Yes, but if we completely immobilize a finger joint, they really start to get stiff. I try to immobilize finger joints as little as possible. Even when people break a finger, I want to get them moving as soon as possible because the side effect of splinting or bracing for too long at a finger joint can mean a really long time of not being able to move that finger and sometimes requiring therapy just to get that motion back. So there are things called finger gel sleeves. Now, I would never use a finger gel sleeve as this picture is on all of your fingers, on all of your joints. But finger gel sleeves are like a silicone sleeve that you can put onto a joint. And I would use it selectively where I would cut the sleeve, right, to fit the joint and then put it on it. These are really helpful because particularly I find with the joints at the end of the fingers, these are the DIP joints, so the distal interphalangeal joints. When they're flared up, they can sometimes be so sensitive that even if you hit it on something, you're like, it's skyrocketing pain. And so what these can do is they basically support the joint by giving it, kind of gives it a hug, helps with the swelling and inflammation, but also is like a protective barrier when it's really flared up when you're trying to get it to calm down. Like I said, I would never wear it like this. I just couldn't find a picture of one just on a specific joint, but you can cut them down and it's kind of like a little hug for the joint and a barrier against outside pressures when you have pain. Other things, hot and cold treatment, cold is good for swelling. A lot of swelling, cold is good. Heat is good for motion. So it's kind of an interplay between the two that you have to figure out what works for you. This is just a picture of, a paraffin bath or something like that. But paraffin baths can be very helpful, especially when you have multiple joints in your hands that are really arthritic. Sometimes that can be helpful and very soothing with the pain in your hand. All right, we talked about the stuff that you can do at home. Pretty much everything that I just gave you, other than an injection, you do at home. I mean, I can get you braces, right? Like the correct braces, get you hooked up with the right things, give you an injection. But then we talk about surgery. So depending on the joint, that's arthritic. That's what guides what your options for. And there's a lot of words on here. There's a lot of fusion or arthroplasty. Fusion or arthroplasty. Fusion means removing all motion. Basically, you take two bones and you become one. So with a fusion, it is pain relieving, but not motion sparing. Okay, so what do I mean by that? Well, at the end joints of the fingers, if you need a major surgery to get rid of arthritis, we do a fusion only. That's the only option. We don't have little joint replacements out there. And so what that means is that instead of having this knuckle that moves, right? Instead, we take away the joint because the pain is coming from the joint. So we remove the joint and we put various means of fixation to then make the one bone heal to the other bone. So it then becomes one whole bone. People are like, okay, then I can never move my finger. No, you can never move that joint. Your finger still has all the other knuckles that they can move. And I don't know if I'm showing this well, but if you were to make a fist, say this joint was arthritic, right? Am I showing this right? I'm not really sure if it's in there good. But say this joint has a lot of arthritis, failed all the conservative treatment, you need to fuse it, right? What that means is that just this knuckle will no longer bend, okay? And so that means if you were to make a fist, you can still bring in, the rest of the knuckles, but then this finger joint stays straight, right? You can't bend it anymore. Now, function-wise, typically doesn't provide a lot of loss of function. People can do very well with it. I fused athletes' joints there because they've had really bad arthritis that limited their ability to continue to do their sport, and it's so painful. and they can still go back to it. I've fused a boxer's finger, right? So like they can still get back to it. Once the bone is solid and it's fused. And the good thing is it's painless. Well, once it's fused, it's painless. I'm not saying surgery is painless. That's pretty much impossible. But once it's fused, you don't have that joint pain anymore. Arthroplasty means maintaining the joint. So arthroplasty is like a joint replacement. Very common with, people talk about with arthritis of the knee and of the hip, which are these big joint arthroplasties. When you start to get to the hand and wrist level, I mean, these joints are getting pretty small and a little tricky. But there are arthroplasties which are motion sparing and pain relieving. So taking away the arthritis of the joint while maintaining some motion. Now, in the hand and wrist, they're not perfect. So you don't tend to get full motion. You're not going to get a normal hand, but we can at least take away the pain, and certain joints in the hand are amenable to getting an arthroplasty to keep motion while relieving your pain. Obviously, there are risks and benefits of any type of surgery, and for that discussion, you need to be seen in clinic so we can talk about it further. We're going to go on to the next slide to talk about what arthroplasty. So these are some pictures of some arthroplasty, right? So wrist arthroplasty, when you have arthritis of your wrist, that's that picture, this kind of a diagram. These joints for wrist arthroplasty is really mostly for low demand individuals because they have a high failure rate if you're high demand. And what does low demand mean? Well, someone that isn't very active. If someone's like a 50-year-old construction worker, manual laborer with wrist arthritis, I would never, ever, ever put a joint replacement on his wrist. The reason being is because the wrist joint replacement isn't perfect and really has a high risk of failure in that type of an individual. But someone that wants to have some motion, has a lot of pain, but is not doing quite as much, obviously still using their hand and wrist, but not as active, our older population, that's the population that could be a candidate for a wrist arthroplasty. Now, the thumb picture, so that's kind of the next one next to it. You can see there, I can't really hone in on it, but that's called a thumb CMC arthroplasty. That's that thumb joint, the base of the thumb. And this is motion sparing, but it's not what you think of as a joint replacement because I'm actually not putting any hardware in there. There's no metal, there's no silicone, there's no implant. I'm actually doing the surgery by removing a bone and then suspending this bone to this bone. Because the problem is between grinding of two bones. And so if you take one of those bones out of the picture, in certain areas where you can do that, such as the base of the thumb, not other places, it's not an option everywhere. At this location, this is a very successful, tried and true way to take care of base of thumb arthritis. Very high satisfaction rate when patients are ready for it. The one next to it is looking at one of these joints, one of these surgeries I've done, where you're taking out the joint and replacing it, and you can kind of see what looks like a little spacer there. That's actually a silicone implant that allows for bending and straightening of the finger. And then the one on the end side is a metal implant. Which type of implant you get for a joint replace, if it's metal or silicone or whatever, that's a discussion with your doctor about risks and benefits and something a little bit more than what this talk is going to go into. We got to go into more detail. If I were to see you and talk to you about it, we'd talk all about this. I love to talk and give education to my patients. Next thing, this is for the wrist, okay? So if you don't want a fusion, but you can't get a wrist arthroplasty, because say you're that 50-year-old that has arthritis, that's a construction worker, and you have really bad arthritis and we need you to do something, these are called salvage procedures. So what do I mean by that? So it's not a wrist arthroplasty, but it's a way that we're changing your anatomy to unload the area that's painful while still maintaining motion, okay? And so these are two really common types of procedures that we do. There's others as well, but for wrist arthritis, where we want to spare motion, but not, but we can't do a wrist arthroplasty. And so these couple of procedures, the one that has the screws in it is a scaphoid excision, four-corner fusion. And the other one, you'll notice, where did all those wrist bones go? It's called a proximal row corpectomy, where we actually remove 3 bones in your wrist. These are both of 2 of my patients. So this is something that we can do depending on your type of arthritis. It's important because when you get arthritis in the wrist, you might get it in one area while other areas are perfectly healthy. And so then we have this option of doing these types of surgeries. Because the next thing we talk about is fusion, right? Now we're taking away motion, okay? When we fuse something, right, no motion. These are all patients of mine that I've had to do fusion procedures on, whether it's at the end joint of the finger, at a knuckle here, the PIP joint here, or the wrist. And majorly what you can see in these are taking away those joint spaces. They are gone. You're bridging bone across a joint. So you don't have a joint anymore. It's a solid bone throughout. And like I said, very good at giving you pain relief. They're obviously not motion sparing because you can't then move that joint, but very successful in many, many patients. Don't be afraid of it. If you need this type of a surgery, I can guarantee you if your doctor recommends it and you fail conservative treatment and you can't do things because of your arthritis, this is a very good option, and don't be afraid of it, okay? People do very well and can do a lot of activities with fusion procedures. So that's the end of my talk. These are my kiddos. They're 4 and 2 years old. Isabella's 4 and Aiden's 2. But just kind of, I hope this helped you to understand a little bit of arthritis, a little bit about what your options are, maybe things you can start doing at home to help your pain and your symptoms before even having to see a provider. If you're wondering about specific details of a specific joint or want to go into it, or you want to get the x-rays to see if you have arthritis, what's causing it, that's when you want to make an appointment. I can't go into detail of every single joint, exactly all of the risks and benefits, but hopefully this gives you a general idea of what things are out there and available for you. And then you could always kind of then come in maybe with some questions, and then we can kind of tailor what we can do to get you better and talk more about the details of, you know, your specific risks, your specific benefits, your specific likelihood of getting better with these treatments. But thank you for joining me. I guess that's the end of the talk, and maybe I'll see some of you soon in clinic, but if not, I hope this helped you with your hands. You know, that's the question I get a lot, like, especially parents want to ask, like, should I tell my kid they can't do it? I hate it. It bothers me so much. And you know what? There's not good studies out there to try to correlate knuckle popping with arthritis. So you got to think about it. In order for us to give you an exact correlation of a yes or a no, we have to do medical science experiments on this, right? So we see, to do that, we'd have to find a whole bunch of people that pop knuckles and how often they do it, right? And at what age are they starting? And then evaluate them 30, 40, 50 years down the road to see if they've got arthritis and compare that to people that haven't done that. And it's a very hard study to do with a really, really long follow-up. So I don't know specifically, and maybe there is out there a study that looks at that to correlate exactly knuckle popping with arthritis. But I will say, you know, you don't want to aggravate your joints. You kind of want to let them be. You want them to be healthy. It kind of feels funky. I mean, sometimes I feel like I'm like, okay, oh, I kind of popped a knuckle or something like that. But when you do it all the time, I just feel like it can't be really great for it. So I would recommend against it, but I can't really say scientifically that there's a direct correlation. So I guess I'll leave that up to you. I personally don't do it, but you know, can't give you the science behind it. So that's where I say that what I was mentioning before, I think, you know, there's definitely a component of genetics. Also the use of the hand, right? So like wear and tear happens when you wear and tear it, right? You use your hand a lot more. So it is very multifactorial. Genetics plays a role, definitely. When I see patients that are young with arthritis throughout their whole hand, I can probably guarantee you that their parent had the same appearing hand. So genetics is definitely a role, very strong component to it. Wear and tear, right? How much are we using our hands? Have you been, you know, lifting or, you know, hundreds of pounds every single day for, you know, 20 years because you're a manual laborer and so you've worn them quicker? That's a component. Did you have some type of a traumatic event to a specific joint? Because that quickens up, you know, trauma specifically to the joint increases like your risk of arthritis and decreases the time to progression of arthritis. So it kind of jumpstarts it and gets you arthritis sooner rather than maybe the later wear and tear that you would have seen without the trauma. So it is definitely, like I said, many patients that have horrible arthritis to their hand and then other patients that don't have much at all. And that's where I've got to say just that combination, the wear and tear, the use, the genetics, prior trauma, all those different things can kind of come together to give you the way your hand reacts and behaves and gets arthritis or not. Yeah, so I'm in the East Valley. I'm in Mesa, our clinic in Mesa, which is right next to the Banner Desert Hospital. So it's right at 1500 Dobson. And that's where I am most of the time. That's kind of my home base. My other clinic is in Scottsdale. It's right off of Shea and the 101. There, I'm only once a week there for clinic, but I was there today actually. I'm usually there on Tuesdays. So if you're in Scottsdale and you wanted a Scottsdale clinic, Tuesdays are the day. And then I'm in the Mesa clinic on Monday, Thursdays, and Fridays. And then I do most of my surgeries. I do operate at the Banner Desert Surgery Center, which is in Mesa, right next to Banner Desert Hospital, and then at our core hospital in Central Phoenix. Any inpatient stays that I do is usually at the Banner Desert Hospital. So kind of that East Valley, Mesa, Scottsdale area. And then to make an appointment with me, you just call the phone number for appointments, the general line. I actually don't know the number off the top of my head, but you can call there. We have a centralized team. I don't know if you guys have the phone number. It'll show up at the end. Perfect. So there we go. You just can call in and you can tell them, I have a problem with my left hand, my right hand, my left wrist, my right wrist, both hands. And I want to make an appointment with Dr. Sumner. I do see, I am in clinic quite a lot, so I try to kind of really get a lot of patients in. Usually you don't have to wait a ton of time to see me. So you can get in fairly quickly within, a week or two. And then the main thing is that if you are coming to see me, and this is a big thing, if you're coming to see me, I am a specialty provider. If your insurance requires a referral, you need to get that from your doctor, and it has to be what side. So if you get a referral, your insurance requires a referral, and your referral from your doctor says left side, but you want me to treat both sides. Guess what? I can't, because otherwise you get stuck with the bill. So if you're having a problem with your hand, and if it's just your left hand, your left thumb, or your left wrist, great. Your referral will be for that if you need them. Not everyone needs referrals for specialists, but if your insurance requires it. But if you want to be seen for both, make sure you clarify that, because you need the referral to be for both. And that's important. I've had some patients that come in, I can only treat them for one side, or they actually come in and then they leave because they're like, I just want to be seen for both, and they didn't get the right referral. So just make sure you clarify which body part you're coming in for, because that does matter. But calling that line and telling them what you're coming in for, and getting scheduled through our schedulers. We have got a great large team of people that answer those phone calls and get you scheduled.